Welcome to Advanced Nurses. We connect with nurses who inspire other nurses by sharing their experiences. And so we're able to bring that information to you. Hello, I'm the educational consultant with Advanced Nurses at ACD4N, and I'm here with Prince Baawuah, and he is actually going to share with us the wonderful innovative tools and solutions he has in risk adjustment as it relates to AI. And I'm just so excited to learn about your tool. I he and I are within the same network, which is a reason why it's so important that when you're on LinkedIn, you're not just on there just looking at jobs. Networking on LinkedIn is also very important. And so when I seen his tool, an ad for his tool, I said, wow. And I learned about Hills Academy, which I do want you to share with us about Hills Academy as well. I said, wow, this is somebody who really gets it. Like just making that connection between risk adjustment, using AI tools, and then also making it user friendly and really bringing that information to the user, I think is just where we really need to be going in healthcare, having leaders as far as in the education and training and teaching space to really help educate, again, those end users. So please, Prince, would you mind just telling us about how you got into risk adjustment?
Thank you so much for inviting me, and I'm very excited to share this time with you. So, in my how I got into risk adjustment, I graduated from the University of Michigan School of Public Health with my MPH, and I was looking for a job, and I had a job interview with the Centers for Medicare and Medicaid Services. And I got the job with the Division of Encounter Data and Risk Adjustment Operations. I didn't know what it meant and what it was, but I got the privilege to work there for over 7 years. And in that space, I learned a lot about Medicare Advantage, specifically in Medicare Advantage risk adjustment. So that was my introduction to risk adjustment. I had no idea about it that much until I started working at the Centers for Medicare and Medicaid Services and started in 2014. And I have learned a lot and grown a lot from working there over the period in risk adjustment.
Wow, thank you. And if you don't mind, could you just give us because you have some really impressive credentials. Would you just mind just high level, just giving me a brief
A brief? Sure.
summary? Yes.
Yeah. So I said my name again. I have a doctoral degree in health informatics from Johns Hopkins. I graduated last year in August, and my research was in informatics and how telehealth or health technology is being used and the disparities around that during COVID. I have a master's degree in health management and policy, master's degree in public health, in health management and policy from the University of Michigan School of Public Health, and have a bachelor's degree in economics from City College of New York. So I'm New York, Michigan, and back to Maryland. And I'm also a certified Scrum Master using Scrum and Agile in leading teams to develop applications easily and making sure it's usable and it's useful for the audience. So at a very general level, those are my credentials, and I'm very excited in this field and how health equity and health disparities are being solved. And that led me into many of the work that I do now.
Wow. And you know what I love about what you've done with your own career essentially is you're really getting like almost like that 360. You're not only just worried about the that project piece, like the innovation piece and being a part of a team, building a product or a service
Mhm.
where you get from that Scrum, education, but you also have that public policy piece where you're also looking at the ethics around what you do and having a positive impact in, how we are addressing the needs of. And I noticed that also what drew my attention when I noticed your products on LinkedIn, well, your focus, you had a special focus on social determinants of health, which is
Yes.
a very important area. I think we definitely need more advocates around using AI and advancing technology, services, and products within that space. So we could never have too much, in my opinion, innovation within SDOH. Uh, so, so please tell me about your tool. We want to learn more about the RAS tool.
So the tool that I'm currently working on, and we built
Yes.
it and to be released very soon, is the Risk Adjustment Success GPT. It's RAS GPT. The tool, the work that we do at Hills Academy is to simplify the risk adjustment learning process and implementation process. We want to empower users either from a clinician standpoint or from a documentation standpoint, from revenue cycle standpoint. We want to make you a master of risk adjustment. Many times, what I have learned over the years of my career is that immediately you talk about risk adjustment, the key word you will hear often is complexity, complicated, therefore people don't want to deal with it. However, it's a core bedrock of our health system because as we move into value-based care, so with my knowledge and my talent, I love to teach, I love to instruct. I was thinking through, how do I best encourage each member of the team so that they become masters of their craft in risk adjustment? And that is one thing that inspired me in working on the Risk Adjustment Success GPT. We want you to be successful in understanding risk adjustment, implementing risk adjustment, and also making sure risk adjustment works for you. You're a master of risk adjustment in an easy and simple way, not complicated. We want to simplify.
Great. Love that response. And I think the most important part of that really is, again, as you mentioned about value-based care and moving from fee-for-service to value-based care, where you really need is you really need a workforce that is well equipped, well
Mhm.
informed, and excited about what that looks like. I think oftentimes what happens is if we don't adopt or we don't start to kind of learn how to integrate new knowledge into our practices, we become frustrated, right? And
Yes.
so we also sometimes lose that zeal and passion for us to really be impactful. So instead of fighting changes, kind of like moving along with those changes really requires, again, this taking up the tools as they present themselves, like the RAS GPT tool, and really integrating it into what we do so that we can be not just more informed, but again, we can keep that zeal and that passion for what we do. Because many of us work in this space, specifically in the outpatient arena, where you're looking more so at that risk adjustment data. You're looking more so at that population that's with that risk adjustment data. So you're looking at your HCCs, your hierarchical condition categories. You're looking at those coefficients. You're looking at the providers that are acceptable for risk adjustment, the ways that we need to submit information, updates from CMS. And with all of those changes, again, like you mentioned, some people feel overwhelmed with it and say, "Oh
Overwhelmed.
man, I can't, I don't,
Overwhelmed.
yeah, I don't want to deal with this." So we need to have, again, a workforce who is comfortable with this information and knows how and really knows how it fits, because then you can have even more innovation, right? When you have
Yeah.
solutions like this taking care of some of that hard work, and then you can kind of look at the day-to-day obstacles or problems that you want to solve, and again, using RAS GPT to help solve those problems. So this is awesome. Thank you.
If I
Sure,
may
sure,
add on, I
sure.
thank you for bringing about the passion, and that is what one area that drives this, because we don't want the frustration to take away the passion that drove you to your area, your clinical documentation, or you as a provider, as a nurse. We want the passion to continue burning, but we want to empower you with the skills and the knowledge and the simplicity that you can use to learn, you can use to work, that continue to keep that passion, that burning, continuously burning, so that you're able to support the team that you're working with, and that is what drives us.
Yes, and I want to also emphasize too, as far as like adding value. A lot of individuals like myself who are certified risk adjustment coders, or if you're, again, my other certification as a clinical documentation integrity practitioner, you're often looked at as an SME, And so, as a subject matter expert, you need to be empowered with tools to augment what you do, right? So
Hmm.
it's so important that even if you just have maybe just a monthly touch point or a quarterly touch point with your clinicians and with other providers in your practice or other providers within an organization, having your SME have tools that really help augment what they do is going to be really important, especially as we continue to see the integration of AI and other forms of technologies and advancements in technologies help us really solve these day-to-day problems. And
Yes.
so I wanted to ask you a question about regulations.
Hmm.
So what regulations do you believe or have you seen kind of govern the use of AI in healthcare, specifically as it relates to development of and the use of your tool?
Yeah, I think in healthcare, nobody can go away without looking at HIPAA. So HIPAA is a great regulation that, as I developed this, although the RAS GPT do not include any patient information necessarily, but nonetheless, it gave some principles that helped as I worked on the RAS GPT. Also, there are several AI focused regulations that I learned to use for this. There are the AMA Augmented Intelligence, the American Medical Association website. There is augmented intelligence, a lot of information on that. The American Hospital Association, because um the GPT is for providers, or even people, the staff that are working with providers, so providers can use it. So I was looking at these regulations that are on several websites that pertain to either providers or clinical documentation, or even the health plans that AHEP, AHIMA, HEMS, and reading through many of these resources for some principles that could help govern how this GPT was developed and how it will be used and how it can augment any user that is working on. So at a very high level, those were some key regulations that I leveraged to understand how the GPT is being developed and how users interact with it. As I said before, it doesn't require any patient information. It is mostly using the tool to navigate the burden of CMS resources, or even understanding them. Many times you can go to Google and search for it, but you may not necessarily get to the right information at the right time, and you may spend several times searching and navigating through them. And the RAS GPT's purpose is to take these resources, augment them, curate them, clean them up, standardize them, and put them together in a GPT-like, which means you are asking a question, you get a response format that makes it easier in your pocket. It's your pocket advisor, and it helps navigate you through this. So I use those for principle wise, to get some principle and idea to help as we develop this. But as I said before, it doesn't require any patient information as you work with the RAS GPT.
Awesome, awesome. And so we are going to get to a demo. I'm sure everyone's excited about actually seeing how this works. So we'll actually include a demo here, and we'll just take a pause here for our viewing audience to actually see how the ROS GPT tool works. Mhm.
So Heels Academy is about simplicity. And our goal is to help Medicare Advantage risk adjustment providers and health plans and all the practitioners and the staff that supports that to navigate through the complexities of the Medicare Advantage risk adjustment program so that they can receive fair, accurate, complete, and timely risk adjustment payments. And those are our key principles. And it was born from the fact that when it was born from looking at something like Khan Academy. When I remember when I was young and I was in school, Khan Academy was a great resource for me in learning. So knowing a lot about risk adjustment and the knowledge that I acquired from working in this space for over 7 years, 8 years, and I'm still working in this space. I talking to providers, talking to practitioners, talking to health plan risk adjustment practitioners. One thing I learned about was the complexity. So how do I better simplify it? And that was where Heels Academy was born. And one thing I totally forgot to mention, which I think is very important. Actually, when I started my academic pursuit, I was planning to go to med school. I was on that route to go to med school, and I stumbled on public health by engaging in a program in a summer medical education program in 2018 at Columbia University in New York. And during that presentation, there was one of the dean was talking about the a story which actually happened in Maryland, and I'm currently in Maryland, about a boy who was 12 years old who lost his life because of health insurance in America, like for his teeth. And that was my second year in the US. I had joined my parents from Ghana to the US, and I was so surprised at myself, like, does this happen in the United States? And the disparities, and it started driving me into the area of understanding health disparities and health inequity, and actually that driving me into public health. And as I learned a lot in public health in my academic and also in my career, the focus of trying to drive health equity also drove me in this, because just think through now. We have been able to democratize many of the risk adjustment knowledge, right? It's not only in the heads of just few people, but just imagine if you are a provider that have a very small staff, you're working with very vulnerable population, either from a Medicare space where you have maybe Medicare, Medicaid enrollees, and you don't have much time, you don't have much resources in navigating through understanding and time. This RAS GPT is for you. It simplifies this. It gives you knowledge at the tip of your hand on your phone, that now you save more time in really doing the things that you love to do. You have the knowledge to help you get the facts, like you're getting fair, right, based on the risk of the population you have. You're getting accurate. Are you coding rightly? What do you need? How to submit the data? Are you getting complete? And are you getting it timely? Because risk adjustment is time bound. So knowing that knowledge, having that intelligence augmented by AI and GPT, this tool and what Heels Academy is to empower you, a provider, a practitioner in that way. And that is one of the areas that drove us in Heels Academy in getting into this space, because health inequity that we see in our country.
Wow. And I'll echo this. I think what actually drove me to risk adjustment as well was my passion for looking at health inequities. Because essentially, what risk adjustment does, it actually incentivizes providers to pay attention to the details. It's like, this is how we can really get it done. If the more detailed we are, the
Mm-hmm.
better quality of care we're providing. The
Mm-hmm.
fact that we are required on a risk adjustment side for you to submit that information, that validation means that no, if this person has 10 chronic conditions, we should be taking care of 10 chronic conditions every
Conditions. Yeah.
single year.
Yep.
Exactly. So it definitely incentivizes providers and practices to be on top of those chronic conditions that we know, in many cases, with the right time, right, resources, we
Knowledge,
could
right?
get a
Resources.
right
Yeah.
knowledge. Yep, we
Yeah.
can get on top of them. So
Yeah.
I want to thank you so much for your time. I do want you to share with me some places that we could find you in the near future, kind of sharing or presenting on RAS GPT, and also where we can contact you just to see the developments of this product.
Thank you so much. So there are several places that you can find me, but a key place is the Heals Academy website. It is www.theheals, HEALS, academy.com. And on the Heals Academy website, you can navigate through multiple things. We have a lot of resources that we give out for free. You can please be on the mailing list so that you don't miss anything from us. So what we do at Heals Academy every month, we take a topic in the Medicare Advantage risk adjustment and we go through them. We have very short series of videos, 5 minutes, 7 minutes, that we go through every week. And at the end of the month, we have a live Q&A on LinkedIn and on YouTube that people can ask questions about what we studied during the month. So it's very an academy. So you are really learning. On the website too, if you navigate to the healsacademy.com/resources, there are so many free resources, cheat sheets that we create and we put out there for free depending on what we are learning for that month. So you can better understand that on the Heals Academy. On the Heals Academy website too, there is the RAS GPT, and we are still collecting wait lists for our new grow team of people that will be getting the RAS GPT for the first time. So we'll be sending out a coupon if you're listening on this, that you can get a discount based on the coupon that we get on the RAS GPT website. On the LinkedIn, you can find me at Prince Baawuah, on my name, searching for my name on LinkedIn. Subscribe, follow. On YouTube, you share, subscribe, link, and please, let's make this knowledge as democratized as possible because we want to move our health system forward. So those are areas that you can find me. Also, I will be a presenter on the Risk Adjustment Forum that will be the RISE Risk Adjustment Forum that will be happening in May in New Orleans, and I have a speaker discount that I'll be sharing also on LinkedIn. You can use that to get, I think it's 15% off your registration. So that's a big deal. So those are areas that you can find me: LinkedIn, YouTube, the Heals Academy website, and we have a lot of cool things and very useful. Not just cool. We want it to be useful and we want it to be usable for you. And there are other programs that are coming. And one thing, if you get on the website, please also subscribe, be on our email list so that you get weekly updates and all the other things that we are bringing out. It's very exciting, and I just look forward to where we all can grow together and make sure you master Medicare Advantage risk adjustment.
Well, thank you. And I'm so glad you mentioned your for where they can sign up, because that's why I really want everybody to get up on the list. The waiting list is really going to really help you be an early enroller, for you to really be able to get to see the tool, I guess, before everyone else really gets to play around with it.
Yes.
And again, accessing the information, seeing how it will benefit you in your practice, and see how it will really augment what you do. So I want to thank you so much for your time. I will be leaving your contact information in the description of this video, and also the code to get that 15% discount for the RISE conference.
Yes.
And I thank you again for your time, and I look forward to connecting, and I'm really excited about what we will be seeing in the future with RAS GPT. Thank you
so much. And anybody can also reach out through email, info@thehealsacademy.com. And we would love to hear from you to see how RAS GPT has been helpful for you, or even how you want Heals Academy to be useful for your use case. So we are always excited to hear from our audience because we want to help you master Medicare Advantage risk adjustment processes.
We want to hear from you. Schedule a free consultation or send us an email at advancednurses@acd4n.com, or visit our websites, www advancednurses.info or www.acd4n.com.